exposure. Let's talk about how we're going to measure these exposures. Okay, so we're going to be talking about radiation quantities and units. Number one is the Roentgen. I've already introduced the Roentgen to you guys a couple of weeks ago with the, inverse square law? Okay, Roentgen's measures exposure rate. It has nothing to do with anything live. We're talking about the exposure that's coming from a radiation source. Okay? So the unit of exposure applies to X and gamma radiation and has in its interaction with air and has nothing to do with living organisms. Okay? That's the Roentgen. What you also need to know here is, okay, so conventional is going to be Roentgens per minute. We're talking about exposure rates here. What we're also going to be talking about here is SI. SI stands for Systems International. Systems International. This is the equivalent internationally. Okay, here we do gallons. In Europe and everybody else does what?
Liters.
Liters, milliliters. Speed is miles per hour. They've got kilometers. We do gallons, they do liters, right? Okay, but we're America. We get our own measuring unit, okay? Because everybody else is doing the Systems International, but we got to be unique, okay? But there's a transition now. We're slowly making our way because most of the X-ray equipment now it measures it in the Systems International. So when you're buying a system, because most of the systems, they're sold from out of the country. You know, Germany, Japan, the Dutch, they all got their own equipment. They got damn good equipment. So their measurements are read in Systems International. Okay, so for SI, it's going to be coulombs per kilogram. Traditional, it's going to be Roentgens per minute. All right, the RAD. The RAD is radiation absorbed dose. That is what the acronym stands for. It refers to the exposure that the patients are receiving. Okay, that's the RAD. Patient exposure. The SI equivalent is the gray. I'll talk about the conversion here in the next unit. In the next lecture. Okay? But RAD and SI, there's going to be a slight conversion. So RAD, traditional. SI is the gray. Number 3 is the REM, which stands for Roentgen equivalent to man. This refers to occupational exposure. RAD and REM are the same. Okay? They're the same type of exposure. Okay? But RAD refers to patient exposure, REM refers to occupational exposure. Okay? But they're the same amount. Okay? Just different titles. REM, exposure to occupational worker for SI is the sieverts. Number 4 is the Curie or Curie. This refers to the disintegration of radioactive substance along with the emission of ionizing radiation. So we're talking about a radioactive substance. Can you give me an example of why we're concerned with this in the radiology department? Who deals with radioactive substances?
Radiation therapy?
Not radiation therapy.
Nuclear medicine.
Yeah, nuclear medicine, because they have radioactive isotopes. So we're injecting radioactive isotopes into the patient. Okay? So the isotopes that come in a regular medicine vial is emitting radiation. So the radiation that it's emitting is what we call decay. So the substance is decaying until it goes back into normal state. Okay, so radioactive decay, that's the emission of radioactivity for the substance to go back into normal state. So here, traditional is Curie or Curie, and SI is the becquerel or the becquerel, however you want to say it. Okay, and then we've got a breakdown. This is a very, very good chart to refer to. Okay, it tells you the different measurements, units traditionally, and Systems International, what media is being measured, and the effects being measured. Okay? So refer to this, it's very good. And then we also have a picture that describes what we just talked about, found in your book. I believe this is Bontrager himself. Wait, do you have Bouchon or Bontrager's, the book? Did you guys even buy the book?
Yeah. It's Bouchon.
It's Bouchon.
Yeah.
It's like
Bouchon because he has the mustache.
Bouchon, this is him, Mr. Bouchon. All right, health effects. Any questions so far, folks? The health effects of radiation. It has been established beyond any doubt that exposure to ionizing radiation can result in damage to the individual irradiated and produce undesirable effects in future generations. What we're describing here is somatic and genetic effects. So let's go ahead and tackle these. First one here is the somatic effect caused by the somatic dose. These are effects to the irradiated individual. The irradiated individual. So this could mean patient, it can also mean technologists. Okay, it's who's ever getting hit with radiation. The somatic effects includes injuries to superficial tissues such as erythema. What's erythema?
Reddening of skin.
Reddening of the skin. And then what's epilation? How about loss of hair?
Oh yeah, Malaysia.
I thought that was alopecia.
No. Well, they are epilation, loss of hair. Alopecia is baldness.
Ah.
Yeah.
So this is the precursor to alopecia.
Yes, so epilation is a precursor to alopecia. Okay. I'm very epilated, by the way. Induction of cancer, such as leukemia, can also is under the category of somatic effect. So cancer, cataract formation. Okay, that's why we tell you to protect your eyes if you happen to be in the room. Wear some leaded glasses to protect your eyes because your eyes can form cataracts from exposure to radiation. Impaired fertility, lifespan shortening. We know that with x-rays, so there was a study between regular doctors and radiologists, okay? So the average length of life. So x-rays do cause lifespan shortening. Their life is a lot shorter because the radiologists.
So what was the average lifespan?
They lose 12 hours. That's it. They last 12 hours. Okay.
They lost 1 day of
Yeah,
sleep.
that's about it. But
It was shorter.
what would you do in those 12 hours?
Sleep.
Sleep. I think I'm with you on that one. Me too. Okay, injuries to the developing fetus or embryo, okay? This is key here because we're talking about the individual being irradiated. If it happens to be a mother carrying a child, this also falls under the category of somatic dose because it's the mother and the child that's getting exposed to radiation. Okay? Next one here is genetic dose. This refers to any effects that are exhibited in the future offspring of the individual being irradiated. This does not include the embryo or fetus because this goes under what category?
Somatic.
Somatic, so we're just talking about genetic, talking about gonadal exposure. Okay, so these are effects which are manifested in subsequent generations, are referred to as inherited or genetic effects. This includes microcephaly. Okay, what's micro?
Small.
What's cephaly?
Your head.
Head, okay, so being born with a small head. Spina bifida is a lack of formation in the lumbar region, exposing the spinal cord. Okay. Blindness, again, that's why we protect our eyes, right? And cleft palate. Now, key information here in both somatic and genetic effects. These are not doses which are encountered in routine radiographic procedures. These are, what we do is extremely low, but how do we know? How do we know that this causes cancer, leukemia, epilation, erythema? How do we know? Based on large exposures with early radiologists, the scientists, Hiroshima, the atomic bomb, okay? The Marshall Islands, Chernobyl. We know this from studying mass populations who have been exposed to very high radiation exposure, okay? But again, we are dealing with very, very low, okay? So these happens with, again, we're talking about large exposures with a larger population, and same thing here. Okay, those who were exposed, those who had kids later, this is the type of effects that were demonstrated at childbirth. Okay? So the effects in individuals whose gonads have been irradiated are slightly different. We're talking about gonadal exposure here. The effects in individual whose gonads have been irradiated are slightly different from male and female. For an acute dose, acute means all at one time. In this particular scenario here, we're talking about all at one time. An acute dose of 300 R, what is that? Are we talking rad or rem?
Rankin, is it?
Not Rankin, because Rankin has no biological effect.
Rad.
Rads, okay, so talking about rads. An acute dose of 300 rads to the female gonads will cause temporary sterility, whereas it's only 30 for males. Why is that?
Because they're outside the body.
Outside versus inside, exactly. All right, so because we're outside, okay, doesn't take a lot of radiation for us to cause temporary sterility in males, whereas in females, the ovaries are surrounded by your adipose, your muscles, surrounding tissues and organs. So those are going to take a hit before the embryo fetus does, or the oocytes are affected. That's egg cells. Okay, oocytes. Again, these are not doses which are encountered in routine radiographic procedures. This has been done through research and study. Radiation can pass through the cell without damaging or killing it. However, ionization occurring from radiation interaction can lead to permanent changes in tissues resulting in demonstrable biological injury. For any biological harmful agent, it is useful to graph the dose administered against the probability of effect. So what we're saying here is, what I'm going to be showing you now is a graph that demonstrates the effects in relation to the amount of dose that an individual is receiving. Okay, so we're going to graph dose in relation to, effect in relation to radiation dose. It's a simple graph. It's a very simple graph. What I'm going to be showing you here is what's known as the linear non-threshold. So again, what we're comparing here is dose and the effect of that dose. This is the effect. This is the dose. Okay? So what we're talking about here is biological effect. In this particular one, let's not even look up here. Let's just look up here real quick. If we start off at 0, and even with just a small amount of radiation, there's going to be a slight possibility of a biological effect. And as the dose increases, so will the effects. Pretty simple, right?
Mhm.
This is, again, known as the linear, there is no threshold, because the moment, no matter how little the exposure is, there's going to be some type of effect. This is what this graph says. Write this down. No matter how small the dose, there will be a biological effect. No matter how small the dose, there will be a biological effect.
What about the same dosage men versus women? Which one get more effective?
We're all the same.
Same?
Yeah, we're all the same. Take my radiobiology class. Because what I'm doing here right now is I'm just basically scratching the surface. When you come into radiobiology, just this topic alone, I'm going to be talking 3 weeks about this graph. Right now, I'm just introducing it to you.
This is the graph.
It is, yeah, it is very complex, so I'm going to keep it basic. Okay? So no matter how small the dose is, there is going to be a biological effect. This is what we follow for radiation protection guidelines. Okay? Which means that I'm not going to take any chances. Every time I enter that x-ray room, every time I hold a patient, every time I step into the hospital, I'm going to be cautious. Okay? That means I am going to practice radiation protection. Radiation protection, we'll talk about this next week. The 3 cardinal rules to radiation protection is
Time. Time,
distance, shielding. Spend as minimal time around the source as possible. Distance, be as far as from the source as possible. And shielding, I'm not only talking about protective aprons, but I'm talking about standing behind barriers. And this is what I do during a cath lab procedure or an interventional radiology procedure where we're using fluoroscopy. I'm standing behind my doctor. I'm using him or her as a shield.
Let him take it.
Yeah, let them take the hit. Let them lose the 12 hours of life. I'm not going to get it, okay? But I also use my doctors as a shield, okay?
Did they know that?
Oh yeah, they know that. They know that. They know. So when they see me standing away, they know what I'm doing. If they see me standing behind him or her, they know what I'm doing. Okay? This is the linear threshold, okay? Same type of graph, except what it's saying here is that
There has to be a minimum dose, right?
I am safe until I hit a certain dose. This is my threshold. As long as I stay within that threshold, I am safe. Okay? Going back to what we were talking about, Bahar, is that our body theoretically falls under this category. Okay? Because there are only certain parts of our body that are more sensitive and less sensitive to radiation. And that's why I talk about it being a 3-week course. Okay? But what I'm going to do to protect myself is I'm going to safeguard myself, and again, the attitude is no matter how small, there's going to be biological effects, even though in theory, this is what our body follows. Okay? So as long as you stay underneath the threshold, it is safe. And it's once you go past the threshold, then you're going to have biological effects. And the greater the dose, the greater the effect once you pass that threshold. Does that make sense, guys?
Mm-hmm.
Yes.
So what you're saying is, the linear threshold is what the effects actually follow, but to be safe, we follow non-threshold. to make
Yes,
sure
this
we're
is
being
what
safe.
we do to
Okay.
protect ourselves with radiation protection because we're around it all the time.
Right.
Okay? Again, we're concerned more with the cumulative dose because we're not getting blasted with large radiation. The doses that we're receiving are increments. Okay? Which means that I'm going to keep my exposure as low as possible with the thought that every time I'm exposed to radiation, there is going to be some sort of biological effect. Okay, so let's talk about Burgoni and Trivandou. Every time I say their name, I get hungry. Doesn't it sound like a nice dish? Sounds like wine and some kind of fancy steak. Burgoni and Trivandou. The radiosensitivity of tissue depends on the numbers of immature cells which the tissue contains, the degree of mitotic activity in that tissue, and the length of time that these cells proliferate. Okay? So it's not alone that we are concerned with rapidly dividing cells, but we're also concerned with how long it takes for them to divide. Is it going to take them a few seconds to divide, or is it going to take them a little bit longer to divide? Okay? They're still highly mitotic, it's just some divide quicker than others. Okay? And what they're talking about here is undifferentiated cells, cells that don't have a function yet. Once they have a specific function, when they become a nerve cell, a muscle cell, a blood cell, now we're able to determine the radiosensitivity. But if there is no assignment to them there, if they don't have a function, they're just a cell, a stem cell, they're going to be radiosensitive. Okay? So based on the criteria that we just talked about, including these three, it follows that blood-forming organs, okay, which means the spleen, for example, your thyroid, and your red blood marrow are going to be the most radiosensitive. Why? Because we are constantly producing red blood cells, aren't we?
Mm-hmm.
Constantly. They're rapidly produced, rapidly proliferating. So they're going to be the most sensitive. Okay? This will explain why, again, when you get into radiobiology, why is it that people throw up, why is it that they throw up blood when they're exposed to very high radiations? The movie's pretty close to the real thing. Okay. All right, where is red blood marrow found?
In your bone?
Which bones?
Long bones?
Long bones, right? Did you guys notice back here? What is the lead protecting?
The femur.
The femur, the long bones. Okay? Okay. So, blood-forming organs, your GI tract, and then you're developing embryo and fetus, especially during the first trimester, because by the, by the end of the second and beginning of the third, the baby's near fully developed, so the cells aren't rapidly as dividing as in the first trimester. Okay, so they will all be radiosensitive than tissues whose cells have a slower renewal rate. So based on what we just talked about here, this is what it looks like. Your white blood cells and your red blood cells are going to be the most sensitive. Okay, they're going to be the most sensitive. And then you got your intermediate, and then the most resistant is going to be your bone cells, your nerve cells, and your brain cells, and then your muscle cells. Okay? So basically, like with your nerve cells and your muscle cells, once those cells die, they don't replicate. Okay? Most of the time. Okay? But especially here with your brain cells, that's why it makes such a big issue with, marijuana. Because you're killing off your bone cells. Yeah, it's very relaxing, but you're also killing your nerve cells. People don't understand that. I'm neither against it or for it. I'm just kind of throwing facts out there. Okay? So when you kill the nerve cells or brain cells, they don't come back. Once they're done, they're done. Okay? And that's why they're the most radio-resistant, because they don't replicate. Whereas these do. Does that make sense, guys?
Mm-hmm.
Okay. All right, any other questions? So we have a quiz on the material that we covered today.